So welcome everyone. I'm Jodi Katzman. I'm the Leadership Chair of Risk Assessment and Safety Protocols for the Live Events Coalition, and I am really excited to share this virtual space with everyone today. We're delighted to bring our Curious About COVID Compliance Forum to you and have three distinguished panelists we're going to be asking questions of and getting great insights from. But before we get underway, just a few guidelines as to how we're going to interact in this space with each other today. Now, this session is going to be a little different from maybe what many of you are used to. It will be uniquely a Q&A forum. So this is your opportunity to ask what's ever on your mind as it relates to COVID compliance and safety as we move our industry forward and reopen live events. It'll be general questions around COVID compliance, risk assessment, logistics, safety, the medical and the science side of things like testing and contact tracing and vaccines and any updates, and cleaning, disinfecting, disinfection, and sanitization. So we need to hear from you. Please drop your questions into the Q&A box, and we'll do our very best to address as many of them as we can in the time allotted. I'll be asking the questions of our panelists that come into the Q&A, and Whitney, LEC's Marcom guru, will contribute from time to time as well. As always, she's behind the scenes helping to make things happen. So thank you for that, Whitney. Please also share your thoughts in the chat. Let us know what you're thinking, again, where you're viewing from if you haven't already done so, and help us keep the conversation going. And since we've been saying from the start of the pandemic, we're all in this together, it still holds true. I want to thank you all for your support of the Live Events Coalition. And if you want to learn more about our work and what we're doing, check us out at www.liveeventscoalition.org. And Whitney can put that link in the chat as well. Our hope for today's session is that you'll each take away things that you can use and apply as live events begin to reopen. But before we jump in, let me just give a shout out and say a really special thank you to the LEC for hosting this important forum. The LEC is a 501c6 organization and was created to provide support and resources for the industry, as well as lobby on behalf of this group during this trying time. This session, as all of our webinars, is being recorded and is posted to our YouTube channel after each call. Now, just a few small disclaimers and housekeeping notes before we dive in. Please be kind and understanding to others. We will not allow anything less than kindness. Please avoid self or company promotion on this webinar. We are a nonpartisan organization and ask that you respect that and all sides' opinions, even if you disagree. Please continue to support each other and our industry through this tough time. We need one another more than ever now. While the coalition members are trying to share as much information as possible, situations and information changes from day to day. So keeping up can be challenging, and we do appreciate your patience with us. It's the policy of the Live Events Coalition to comply in all respects with federal and state antitrust laws, and discussion of any matters relating to competition among our attendees or relating to practices that may restrain trade with third parties is not permitted. These prohibited subjects include prices, allocating territories, boycotts, or any other statements that may be construed as anti-competitive. And finally, please note that while the coalition members may offer ideas and advice, we are not legal or financial experts. Our panelists may be experts, however, the information shared may be different for your unique situation, and we advise you reach out to your own lawyer, accountant, bankers, or business manager for expert opinions and advice. So with that, let's dive in. I'm really honored to share the screen with three subject matter experts today who will cover various aspects of COVID compliance. Lindemud, Steve Arehart, and Drew Maurano. Now, I know they're all eager to share their expertise and insights with you, so let's get to it and bring in our distinguished trio. I'd like to welcome Lindamood. She has served as the Vice President of Safety and Logistics for Linder Global Events since 2009. Linda has distinguished herself as a leader in the live events industry, as well as a subject matter expert in COVID-19 prevention, mitigation, response and resiliency, logistics, incident management, transportation and crowd management, security and agency liaison. Linda is a trusted thought partner and continues to lead Linder's liaison efforts with local and federal agencies, law enforcement, and emergency managers to the design and development and operational testing of emergency management plans, including transportation, crowd management, safety and security strategies, disaster prevention, evacuation, response and resilience plans for day-to-day operations and large-scale public events. She was also accepted into the Navy Postgraduate School Center for Homeland Security and Defense Executive Leaders Program, representing for the first time in the history of the program, the live events industry. She is expected to graduate this month, April 2021. Hi, Linda, my safety sister in crime. Glad to have you with us today.
Thank you so much. I'm thrilled to be here.
Addressing the medical and science side is Andrew Drew Maurano, BSPA-C. He's an assistant clinical professor of emergency medicine for the George Washington University Medical Faculty Associates and currently DC Department of Health and DC Hospital Association clinical advisor on emergency preparedness. He's a national leader in disaster and event management, having served as the assistant medical director and operational task force leader for the Department of Health and Human Services, HHS, National Medical Response Team for the National Capital Region from 2007 to 2011. Drew currently serves as the Chief Medical Officer for the Washington, D.C. Disaster Medical Assistance Team under HHS. He has been involved in numerous medical-based projects throughout the Washington, D.C. region, including the HHS Medical Response Plan for presidential inaugurations, several national triathlons and marathons, numerous local and federal events and rallies, the AT&T National Tiger Woods Golf Tournaments, and 2011 USGA's US Open. Welcome, Drew, and thank you so much for being here. Rounding out our panel is Steve Arehart, GBAC, that's Global Biorisk Advisory Council, Director of Program Management. Steve has more than a decade of environmental health and safety, EHS, experience with a focus on general safety, biosafety, and biorisk management. Prior to joining GBAC, Steve spent more than 6 years with American Axle and Manufacturing, Inc. as an EHS representative. He holds a degree in biomedical science from Western Michigan University. Hey, Steve, happy to have you join us today.
Really happy to be here. Thank you for the opportunity. I need to add some more words to my bio. Thank you.
I think everybody needs to add lots of more titles, and my gosh, like they go on forever. It's phenomenal. So welcome everyone. And before we dive in, I wanted to take a quick poll, and I know it's going to pop up on your screen. So how familiar are you with COVID compliance and safety protocols? So this is a single answer, just pick one. COVID compliance officer, that's me. I know a thing or two. Or COVID, what? Ah, very interesting. Kind of what I thought. I don't know about our panelists, but that's kind of what I thought, that most people would fall into that middle range of, I know a few things. I'm not an expert and I'm not a beginner, but I kind of know a thing or two. And then the other half of the poll, have you already started applying protocols and guidelines to your events? I'd wager a guess, but I'm going to bite my tongue. Ah, good. 72% yes, 28% no. All right. So hopefully today we'll get some more information to you that will help you carry this forward as we begin to reopen live events. Oh, I love saying that, reopen live events. Gets me all excited. So I want to start by asking each of our panelists the following. What are the unknowns in your experience, the common denominator? Like what keeps popping up as people's biggest concern and that you get asked the most around event safety and COVID. And I'm really interested in the biggest misconception, the thing that most people don't really understand about the work you're doing around event safety or COVID compliance. Linda, I'm going to start with you, and then we'll move on to Drew and Steve.
Okay, so this is my crystal ball, the unknowns. So it's interesting because, you know, we've made some great headway as a nation in the vaccines, in really starting to, you know, the testing and all of these other things. But one of the interesting questions that I get asked all the time is, when are we going to get back to work? That I don't know the answer to. However, and I think that Drew will be able to add to the answer to this when he speaks. But, you know, what I think we're going to start to see is the quicker the nation gets vaccinated and the percentage of citizens that are vaccinated, that's going to allow us to get back to work a little sooner. You know, I know that the mayor here in Washington, D.C., is feeling quite confident and is really pleased with how we're doing in DC. And there's a consideration of opening up events, if you will, and venues with a capacity percentage and things like that. But at least we're starting to open up. And with that opening piece is COVID compliance and making sure that the right people are watching what's happening, that their plans are good, that all the considerations are being made. When you listen to Dr. Fauci and his team, you know, we see a lot of variants that are happening across the nation, across the world for that matter. You know, based on the rate in which we are all getting vaccinated, Dr. Fauci has mentioned some things about us in the fall being able to open movie theaters up and venues and start to do gatherings and things along those lines. I think that's a great hope. And I would say that, you know, if we all are diligent and we are all contributing, I think that is a possibility. The one thing that I will say, and I say this to everyone, and I know that the LEC has had a campaign on making sure that our industry does what it's supposed to do, that they have the right guidance, that we have the right voices at the table. And one of those things is that we can't control what other people do, but we can control what we do. And as an industry, as much as we can talk and share knowledge and put processes in place and help each other get back to business, the industry will stand alone. It's how we move forward. If we move forward and we're not cautious and we just throw caution to the wind and we start having big events with no masks and no mitigation practices or measures in place, we as an industry will suffer. This industry needs to stand united, learn from one another, lift each other up, and, you know, hopefully, you know, if things go well with vaccines in the fall, maybe we can get back to larger events, and maybe we can start to get back to what may be considered the now norm. So to the folks that keep asking me when we're going to get back to business, that's the best answer I can give. Let's own it and take care of it. And I think that that's the best advice I could give to anyone at this point.
Yeah, that's great. And Drew, what's your take?
So yeah, that one question, right? That's what's driving everybody, because we all have budgets and deadlines and, you know, futures to plan for. The big one that I get is, you know, they keep saying, what is the thing I need to do? What is the thing I need to buy? What is the thing I need to invest? And it's really, I kind of give an analogy of a toolbox. If you want to build the right table or the right whatever, it's not one tool. It's a toolbox of the right things. And so I don't think there's one answer to this, to getting us back open. When we look at individual plans, when we look at individual methods and procedures and protocols, it's having the knowledge of bringing all the little pieces together forming that toolbox that allows you to exceed. So having the ability to distance, have the ability to clean, have the ability to provide air, spacing, mask enforcement, those little things all play into one thing, right? It's not that you go out and spend $10,000 on this temperature system. It's a lot of little things can make the right product here. And so I think with just some knowledge and some good planning, hopefully if things continue as they are, we'll get back to open.
And Steve, I'm sure you have to dovetail on what Drew commented on in terms of the ventilation and things like that and cleaning.
Certainly. So to preface my response, I just want to be clear of the angle that I'm coming from. GBAC, or Global Biorisk Advisory Council, is part of ISSA, which is the International Sanitary Supply Association. So that's the cleaning industry trade association. So the kind of where I'm coming from is how can we affect processes related to cleaning and disinfecting, but then also capture this big bucket of infection prevention and how those two are related. So the biggest question that we get is how do we take these cleaning activities that we've been doing forever and say, okay, instead of defining clean as was a task completed, does it look good, and does it smell good, to how do I ensure that my cleaning and disinfecting processes are truly effective at lowering infection risk. So that has been the entire backbone of how we are trying to help. And me specifically, I'm in the live event kind of space. We're in transportation, convention centers, hotels, hospitality is big, but I stay kind of in this in event space. So we're constantly trying to help people navigate how to be truly effective with their cleaning and infection prevention techniques. But also things like, let's see, I mean, getting back to be able to have these events and what are the steps that need to be taken to get there.
Fair enough. Fair to say our crystal ball is quite muddy. But less muddy, I think, than a year ago. And so that's, steps forward. So questions already starting to come in. So I have a question from James. I'm thinking Linda and Drew, when do you think they will take the compliance control from the event industry to the health industry, i.e. make it health codes like smoking, food, and beverage?
Drew, I'm going to let you answer that because I think that our codes are going to remain in place. And right now, the government is not taking a federal, they're not making a federal mandate across the board. So Drew, if you can chime in on that, I'm not quite sure what your thought would be on that.
I would have to define that question a little bit, right?
Yeah.
Because the question is, in terms of the other health complexities that affect us and cause illness, are we expecting that the government pushes regulations towards that, meaning things that cause diabetes and heart disease and cancer? Was that the question? Or was it more the venue based of bars and restaurants and stuff like that? I think I would need some clarity on the intent of that question.
Okay, James, if you could clarify a little bit in the Q&A, and then we'll come back to that. Drew, why don't you take this opportunity to give us a little bit of an update on the science side, to move us forward.
Sure. If someone's able to post my slides, then I will just ask you to advance as need be. Perfect. If we can go right to the second slide. Perfect. So I wanted to use this 2 minutes to kind of set a picture for us. The policies and procedures of this country, by a nation, by the counties, by the cities we live in, are pretty much driven off of numbers. There's numerous amounts of politics and finances and everything else that's going into this. But I think the reopening of events will be driven by numbers. And so the good news is, as you can see, we're on a downtick, and then you hit about St. Patrick's Day, so a lot more of the restaurants were opening, things started to relax, and we began to plateau. You can go to the next slide. The good news is, even with that plateau, our death rates are continually going down. And that does mean that our systems, our medications, our hospitalizations are going down, and we are heading in a good direction. Next slide. Part of that is due to a couple factors. One is the work that everybody on this call is doing with sanitation and masking and restricting of people in the venues and restaurants. The other arm that we now have since December is our vaccination arm. And what we're really seeing now is about 20 to 30% of the United States is beginning to get vaccinated, already has shots in arms. And we look to, on the current projection of the vaccine coming out and workforces in each state, kind of looking to be at what we want to be, that 60 to 70% vaccinated, probably around the 4th of July if we go off federal projections. Next slide. And this is where we sit with that in DC. If you want to go to the next slide, I'm just going to kind of go through some slides that I thought kind of put this all into perspective. Like, how do we envision reopening when we look at these numbers, as every news media and everybody are sending numbers at us, right? We all hear about this daily case rate. The daily case rate is important, but we need to take it in metrics with a lot of other things. We got to look at, are the hospitals overwhelmed? What is our death rate? So if our death rates are going down, even in a spike of upness in terms of the case rates, that tells me that most people that are getting this right now are somewhere between 18 and about 45 years of age. So they're getting it, but they're not getting that sick. Our hospitals are only at 77, at least in this region, at 77% effectiveness. To be honest with you, before COVID, with just regular tourism and daily life in DC, we were operating in like 96%. So we're in a good position in terms of the hospitalizations. We're in a good position of test turnaround, right? Our tests used to take 5 to 7 days. Now labs get extra money if they get those tests turned around within 2 days. And guess what? It's taking less than 2 days. So our positivity rates are up. People are out more. People are traveling with spring breaks, between college spring breaks and now family spring breaks. So our numbers are going to stay up for another month. As long as our hospitalizations and the negative impact of those cases continue to go down, I think we're on a right trajectory. Next slide. And what that means, especially in DC, is as this vaccination rate goes up, those numbers should continue to drop. Next slide. And next slide, sorry. The path forward, though, is going to remain this. It's going to be a combination of getting the numbers down, but also being smart. And so the mandates that people are referring to, and those idea of, focus at these events and venues, is still going to be on these main 5 points, right? We're still going to have to promote an area of behavior with that spacing, that is minimal capacity, thinking outside the box with opening tents, bringing new air, increasing sanitation. This is going to stay with us for a while, but it will at least will allow us to reopen. Next slide. Next slide. And so in DC, the mayor is looking at this, and for once in the world, DC kind of fits in the middle of the bucket in the country and how we're thinking. And right now, the thought is, if we continue at the current vaccination rate, the current hospitalization and case rate, this is what May 1st should look like through most of the country, if not even better in some parts of the country. That we're going to be up to 25 to 50%. Go to the next slide. Of seating in movie theaters, right? Our wedding should increase. We're going to have graduation ceremonies and outdoor ceremony and awards banquets and those type of things, and start pushing to our higher degree of getting back to normal. Next slide. With the outdoor stuff being races in our pools and our outdoor events in the summer, which, for fairs and festivals and those type of things, getting at least up to 50% by May 1st is a great predicting value. Next slide. And as we see these libraries and centers open, we're going to look at those numbers. If the numbers continue to plateau or stay down, with the two big numbers I want you guys to look at, if your region infection rate stay, right now we're at 5% is like a plateauing, if not increasing a little bit. If we get below 2, which means our R value stays below 1, these percentages can come off. Next slide. All right, you can come off shared slide. My last point is that's May 1st, and I think that will look like most of the country May 1st, with 25 to 50% capacity, allowing outdoor venues to open, indoor venues to open, with the goal on federal projection that on July 4th, we'll be up to indoor venue stuff at least 50% and outdoor venue almost near 100%. And so that's at least the light at the end of the tunnel. If you had asked me this about 6 months ago, I didn't know if that light was our path forward or a train coming at me, but I am pretty confident if we can keep on, these numbers, that light will be hopefully by July, kind of that light at the end of the tunnel. So thanks.
Thanks, Drew. That's very enlightening. Steve, I want to pop over to you. We know that cleanliness and disinfection can help reduce the risk of exposure and are key to reopening public spaces, according to the CDC. They've obviously issued reopening guidelines for how to properly clean public spaces, including what the appropriate disinfectants are and how frequently surfaces should be cleaned. What are the strategies event planners should consider implementing to maintain healthy environments? Like, what are the best practices, and what do we need to know about cleaning and disinfection?
So first and foremost, getting a grasp on what a risk assessment is and how to conduct one and how to make it visual so everyone can understand what the risk assessment is telling you. I think that's one of the biggest gaps that we see when we're working with these facilities is truly understanding where your highest risks lie and how you mitigate those risks. So that to me is number one. Also understanding the difference between cleaning, sanitizing, and disinfecting. There is a difference. The cleaning is just going to be removing visible dirt, soil, grease, what have you. Sanitizing and disinfecting are similar, but you get into kind of the order of magnitude of germs and viruses and bacteria that's being deactivated or killed. So understanding that trying to disinfect a dirty surface before cleaning it is not going to be very effective, and actually can be harmful in a haphazard way of cleaning and spreading versus eliminating and removing. So nailing down those two things first, and again, really understanding how do I identify my highest risk areas and how do I prioritize the cleaning and disinfecting of those areas first to then limit the possibility of transmission. Great.
I've got a question from James, which was similar to a question I would have asked if I was calling into this forum. Would it be plausible to lump mask wearing in with the old no shoes, no shirt, no service? Linda, I'll start with you.
One second. I'm sorry, I was looking at the questions. Could you also repeat that for me, please?
Sure. Would it be plausible to lump mask wearing in with the old no shoes, no shirt, no service?
Absolutely. Absolutely. And as a part of the event planning and actually what is in some cases required now in certain areas around the country, the COVID compliance officer, that person is on site for events, and their sole focus and mission is to make sure that all of the COVID compliance protocols, procedures, measures that have been put in place for the event are adhered to. So a little bit about that, though, is, there are ways to bring people into compliance with that well in advance, to set expectations. And a lot of people, they just don't know. So as much as you can communicate ahead of an event, whether it's through the registration platform, whether it's through the website, to let people know what they should expect when they get there. That is 100% mask wearing event. We did an event, a live event, right in the midst of the pandemic, and we I would say 75% of the people at that event were high-risk folks. And we were able to communicate with them on the registration. We were able to, through the app, do a pre-event questionnaire. We were able to share the ordinance guidelines with everyone. So when everyone showed up on site, they came prepared. And if they weren't prepared, then we took steps to make sure that they had all of the PPE that they needed. We had masks, we had face shields, we had gloves. The whole key to the success of this is making everything readily available, as well as not making people feel put out or picked on. Messaging is key in this, and as quickly as you can do it is the way to go. So yes, the long answer to a very short question is absolutely. Masks are no shirts, no service.
And flipping over to that, from an event host perspective, Linda, can you and should you survey attendees prior to the event as to whether they are vaccinated? And what are the pros and cons of asking the question or not asking the question?
I think that Drew's going to be able to answer this as well. But yes, absolutely you can. So there's a lot of questions around how we track vaccinations. From a homeland security perspective, that's one of the biggest missions right now, is to figure out how not only do we get the entire nation vaccinated, and even our international visitors, how do we track those vaccinations and who's done what? There's talk about a vaccine passport. There's talk about, in state localities, making something on your driver's license that says that you've been vaccinated for COVID-19. So there's all kinds of planning behind the scenes right now. But the attendees for, how do I say this? The folks that are coming to the event, it's my experience, if they have a vaccine, they're waving that card around. I have not seen such happy people in my life than the people who have completed their vaccinations. So there's that piece. But I know that there is a bit of a privacy and HIPAA things that are in play, and I would kind of push that over to Drew to talk about how the medical side of that is managed.
Sure. Do you want me to
go for it, Drew? Yeah.
So two things. That mask question is really interesting. I'm working with a lot of clients all over the world and really all over this country. And the issue that you're having is right now masks are a mandatory expectation, let's say, but then we are going to see, we just saw Texas come off the regulatory side of this and other states are following. The issue is going to be, as a venue or in the event world, is right now it's easy to mandate a mask because typically the jurisdiction is mandating it for you. And that expectation with that event is there. Once the jurisdiction backs off on that, you're going to see more and more in the next couple of months, and probably a significant amount of states are not going to be mandating this somewhere in the summer. What is your job as an event planner? Do you continue just to uphold the local laws and expectations, or do you feel that it needs to be to your side? And so I think it's going to be difficult to mandate masks if the jurisdiction is not mandating it, right? And we're going to have to kind of work that expectation. But I think there's also going to be a gray period where people are going to come in still wearing masks, even though it's not, because they feel more comfortable in a mask. And 50% may not be in masks and 50% are in masks just because that's their comfort level, because they're going inside to watch a movie or listen to a band. So the question as event planners is, do we allow that to just naturally happen, or do we try to make it a more comfortable environment for those? Do we go back to the 80s and 90s where you had a smoking section and a non-smoking section? Are we going to have mask sections and non-mask sections just to help people, or at least offer a mask section if people want that to feel more comfortable? So I think that the mask is going to play out in a very unique way, but I think it's going to be difficult to mandate past the local jurisdiction's mandate. The second question on vaccinations becomes very difficult because I'm running one of the largest ones in the DC area, and we're giving out these HHS cards. I can go to Kinko's and make those HHS cards. So there is a national database that we report to the CDC. Do I see the CDC allowing, or the feds allowing the CDC to share that information with local jurisdictions to develop passports and like things? I don't see that happening. I think from HIPAA and security reasons and people's privacy issues, that won't be it. So it will be a self-reported thing. I don't think then you can take the word or mandate admissions or preferential treatment to those who coming to your event. I think what it helps us do is, you know, if we're doing some type of COVID compliance, where we're looking at those who are entering our building, right? It helps us on the tracing. If jurisdictions are putting tracing on the event, that, hey, anybody who comes into your place, you need to know who's in there. I think, you know, we're never going to, I don't know, maybe we'll ask people if they're vaccinated or not, but I think it's just going to help on the back end to see who do we need to trace and not trace. And so it'll be interesting to see where that plays into this, but I don't think it'll be a factor at the event level. I think the rate of vaccination will dictate how open the event industry can get.
Yeah, and you know, I think that we also look at this similar to how we have with testing. You know, your question, Jodi, was, you know, can we ask them about vaccinations? You know, yes, we can. But we also, in some instances, are mandating testing for folks that are coming from out of state. And, you know, Drew has helped us with that in different events that we're doing. But, you know, I think that the vaccination, proof of vaccination, is very similar to the proof of positive or negative testing as COVID is brought up.
And I have a two-part follow-up to what both of you just said. Obviously, with the vaccines rolling out across the country, why are testing protocols still relevant at events? And the other piece is, do you recommend planning an event where everyone must be vaccinated, or are other mitigation measures such as screening and testing adequate?
I'll take a stab at that. So one of the things about testing, and I'm sure Drew can add to this, is the testing is expensive. If you're going to have a big event, you know, and every single person has to go through the criteria, because if you think about it, you know, in some of the programs that I've done with Drew, you know, when you're looking at someone coming from an out of state, you know, one of the protocols is that 72 hours prior to travel, that they do a PCR test, and they have to present negative results. When they land in their destination, they take a rapid test just to make sure that nothing has changed. And then when they go back to their home, they take another test to make sure that they didn't get anything while they're here. So, you know, when you think about that and you're looking at that, let's just say for a 2,000 person event, that's everybody is traveling in from out of state. That is an expensive thing that you have to think about. And I think that probably one of the follow-up questions that coming from the statement that I just made is how do we budget for that, and who pays for that?
Who pays for it? Yeah.
Is it the guests? Is it the client? Is it the venue? Those are all questions. And I think that all can be responsible for that. So I kind of tossed to Drew on what his thoughts around that are.
Sure. So, you know, we've had a number of events where we've done weddings where we've tested everybody the day before, or those type of things. That creates a very safe and reliable event if you're using a PCR test. The cost on that, as Linda said, is astronomical. Using antigen tests on the day of an event. So you're going into the wedding or you're going into the concert hall, you're gonna that's could be up to 20 to 30% false negative rate. So you're doing something that has a little bit more, but to be honest with you, it doesn't get you, it doesn't take away your risk, right? Steve talked about that idea of risk. And I think as long as we are upfront with everybody on what the risk is, I think there's a sense of our duty, sense of the jurisdiction's duty, and a sense of personal duty. So I think outlining the risk and what you're doing to mitigate it. Yes, if you were going to do something where you were going to do a testing algorithm, you needed a PCR 72 hours in advance to get into your event, or evidence of vaccination, that would make it a very, very safe event. The cost and the willingness for people to do that would be a big barrier, unless it's a huge event. Like if you're doing the Grammys or something, yes, I would encourage that. If you're doing a nightly show, I don't know how many people here have a venue where people would be willing to do that. So it's an individual risk benefit of how safe you can make your event.
Steve, I'm going to pop over to you. Question from Robert. I'm coming from an event lighting company perspective where we don't deal with organization of guests, and most of the time we are out of the space before the guests arrive. How effective is self-evaluation of our employees versus screening temperatures when they arrive on site? And how much should we worry about sanitizing equipment that nobody but employees interact with?
I mean, I still think it's a good idea to, again, evaluate the risk. What are your high touch points? If there are multiple people handling the same exact equipment within a short period of time, I do think it's a good idea to clean and disinfect that. In terms of the screening question, I think we're all pretty well versed in the self screen at this point, and being able to make a good sound decision to keep yourself and the people around you safe.
Linda, question from Marilyn. I know you're chomping at the bit to answer this one. Where online can we find COVID guidance when planning for New Jersey live events this summer?
Well, there are a number of places that you can get guidance. You know, I would say that you can always go to CDC. Anything that you type into CDC, you can type special events, you can talk pets, whatever you type in, there is some type of guidance for that. You know, same thing for World Health, same thing for OSHA. You know, all of these different organizations, of course, you know, offer training. You know, the Event Leadership Institute offered some on-site pandemic training. I know that, you know, the ISSA, the Event Safety Alliance, they have different things. You know, we're working on right now a full-blown COVID coordinator course that we're getting ready to offer. You know, I think that, you know, where you go and who you know is where you can get that type of training. But I would say that in your localities, the Department of Health, the Department of Human Services, they also offer things. Right now, I mentioned earlier that in some localities, a certified COVID compliance officer is required. And I will tell you all, certified is interpretive. So, you know, all depending on which industry you're in or what you're doing, the COVID compliance officer training is different. So there is no federal COVID compliance officer training that I am aware of. But there are many, many other industries. For instance, the Health Education Services offered something for film tape and for the live industry for, you know, testing or for COVID compliance in the zones and everything. And I think, Jodi, you can even talk to that.
Yeah.
Because we both took that course. So there is a ton of resources out there, but there are people on this call right here that could point you in that direction. And they're from the Live Events Coalition. You know, we do have a safety committee. Jodi and I both sit upon that. We are happy to, you know, help you offline, get connected with the industry of your choice. and then point you in that direction for any type of COVID compliance officer training. So
I'll add that the Georgia Film Academy also has COVID compliance training. Lanky and Limey Limited offers guidance on and certification courses on COVID safety officer, which is now a new role that's being mandated. I know in New York State, our state has mandated that we now have to have a COVID person. There's not a title. It's really just it's not even an advisor. It's just like a COVID presence on all events, concerts, festivals. So that's another new role. But Lanky and Limey has a lot of courses that I've taken that are really, some of them are 8 hours and longer, but really in-depth, boots on the ground training.
Right.
So there's more courses to take, trust me, than there are days in the year.
yeah, and one other thing, if I can add to that. So right now we're talking about COVID. We're talking about COVID-19, and what you're seeing is other people changing their courses to be pandemic. What we know right now is that we're in a much better place as a nation and as a world to respond to pandemics or epidemics or health crises. I see some type of infection, pandemic, COVID mitigation. This is going to be the standard in our world. So this is not something that has a short shelf life. This is going to be something that we're going to be living with. I think, like Jodi said at the top of the call, that it's going to change. Everything changes. We get all types of, we're getting the new strains and things like that. So the guidance is changing. So one of the best things that we can do is educate our organization and educate our staff. So everybody is a COVID compliance officer or person, a COVID person, like Jodi just said in New York. That's where we're all going to come through on this. We hold each other accountable and make sure that we're doing the right thing for our guests and for our community, for that matter. So this is going to be around to stay.
Yeah, for sure. Steve, got a question for you from Kevin. Is there scientific data that confirms it can be transmitted through contact with surfaces? It would seem to me that if it could be transmitted this way, the problem would be way worse.
Well, I think the scientific data comes in the ability of an infectious agent to survive outside of a host. That data is there. That data is real. In terms of how did I become infected data, I don't think anybody can rightfully say this is how I got infected. When you catch a cold or catch the flu or any sort of sickness, you can't definitively say I caught this from talking to this person, or I touched a surface and then touched my eyeballs. So I think that one is, it's hard. You really can't put hardline data of route of exposure, but you have to look at, is this viable to survive on a surface outside of a host? How long can it do that for? The whole hand hygiene campaign is not for nothing, right? That is directly related to surface contamination and washing your hands to keep yourself safe. So again, the data of route of exposure is so subjective, and I don't think that you can truly say how exactly one would be infected.
Can I add to that?
Yes.
So that's an extremely difficult question, but it's a great question. It's something every one of us, from our kids to our colleagues, think about, right? The issue with defining that number is you got to create the environment that you live in, right? And you got to do it in a cultured environment. So when they, if we original data we got was from cruise ships when this all started, right? And these were dark cabins with good moisture and air and low airflow, right? So you had no UV penetration. They were cold rooms because the heat had been turned off, and there was a fair amount of moisture in the air. And so we were seeing things culturing out almost a day or two later, and that's where everyone got really nervous about this. But then as we realized, you add UV penetration or light, you add airflow movement, you add heat, and you add lack of moisture, that number goes way down. And so now you're looking at what's called an average length of time. And so we say, well, yes, things can lay on a surface for an average length of time of maybe 4 to 6 hours, right? That's still, to get 4 to 6 hours, you need low UV penetration, no chemicals introducing, a large amount of moisture, meaning snot or mucus that the virus sits in and doesn't just evaporate. So for most of the time, if you're in a lit environment with UV penetration, with light greater than 70, heat greater than 75, and not a lot of moisture, so it's just a sneeze or a cough, and it's just small droplets, those are gone in seconds to minutes. The question is, did somebody come by in that 20 minutes and touch something? So that's an answer that's really difficult to get. People are always going to give you the worst number. So we're always saying 4 to 6 to kind of make sure everybody's saying that in the worst case environment that things can live that degree. So it allows us to take that as our information and then apply it, right? If we're outside, we're in 75-degree or plus weather, we have airflow movement, yes, that's going to be much smaller than if we're in a dark, stuffy movie theater or venue or whatever. So we just got to be smart and kind of understand that there isn't an optimal answer, but that there's still a small relative risk of transmission, and do what we can to mitigate it.
Steve, a follow-up question for you, and I'm going to tack on to the question that came in from Amanda. The CDC came out with revised guidelines on cleaning on Monday, essentially reducing the recommendations on disinfection requirements in general. How does that impact event cleaning? And I'm going to toss in, if after you respond to that, if you could talk a little bit about the GBAC STAR facility accreditation and why it's important, and maybe also the WELL health safety rating for facility operations, so people have an understanding of that as well.
Sure. So we talked about this internally as a team today, and we weren't thrilled with kind of the language that was put out by the CDC, because I think it leaves it open a little bit too much to interpretation. I think it's really meant to speak to your environment, in your house, in your car, in the space that you exist in. When you're out in public, to me, I don't think that was meant to be interpreted as in a public setting that we don't need to think about cleaning and disinfecting anymore. And I think that aligns right with what we just talked about. So with what Jodi is talking about with GBAC STAR, that is what we at GBAC created last year. It's an accreditation program. We have a vast scientific advisory board of infectious disease doctors, researchers all over the country and all over the world that we rely on, and then relating that back to cleaning. But it's really science-based and performance-based system where we help facilities navigate some of the real science versus the voodoo science. When you get into what products are available, what is this new technology coming out that they're trying to sell me, $250,000, escalator handrail, UV light, thinking about those things. But we also, we really heavily weight this on a continuous improvement, performance-based system, and trying to help people develop good comprehensive standard operating procedures, good comprehensive risk assessments, and then being able to collect valuable, useful data, particularly within the validation arena of cleaning and disinfecting. Are what we do, what we say we're doing, are we doing it, and is it effective? And here's how we measure it. Not only are we looking to help create a healthy environment and healthy buildings, but this also is helpful when we're talking about use of resources. We look at how are you managing consumption data of your products? Are you constantly diluting too much or too little, and you're wasting product, or you're rendering it ineffective? So we try to help people kind of navigate and optimize that. And that includes different programs that are coming out of the market. I know Kimberly-Clark has a system that you put in your hand soap dispensers, your paper towel dispensers, your toilet paper dispensers, that help you alert your custodial staff, hey, we're at 80% usage, now here's when I go in and clean the restroom and restock, versus just doing it on a schedule and wasting time and resources. So that's kind of GBAC STAR a little bit in a nutshell. There's other things we look at with documentation control. You know, we've seen SOPs from 1996 that people have submitted, and it's suffice to say they're a bit outdated. From a well health safety building, I know everyone has seen the J-Lo and the Lady Gaga commercial, right? In a sense, we're kind of competitors, but we're also different, and we've actually partnered with them. We've partnered with a different organization that CDC is partnered with called Fitwell. So we're trying to partner with all of these, because we're all looking for the same goal, right? We're especially me, I'm looking to get back to concerts and Michigan football games. That's what I'm trying to, that is my motive behind what I'm doing. So we're all trying to incorporate how do we get our environments up to a standard that frankly has needed to happen for a long time. I think we're going to see a lot of our annual flu season. I think those numbers are going to be extremely low this year based on everything that we've done. And I'm hopeful that data will screw in the light bulb for everybody to say, hey, this is something that we should be doing continuously to help keep people safe and healthy, not just pandemic related, but beyond.
Yeah, makes perfect sense. An Andrew, Linda question as we start to wrap up. How should one evaluate having an event in a state that has not and does not follow CDC guidelines, especially as we look to the fall? Yeah.
Wow. Drew, go first.
That's a tough one. That's a great question, but it's a tough one.
So, you know, we just saw Major League Baseball open, and we see, you know, variations from people with 2,000 people in the stands all the way down to packed stadiums without masks. So the good news for us and the bad news for some people is that we're going to see data here in the next 28, you know, the next 3 to 6 weeks will be a data mine for us. We'll be able to see in live time, what do the numbers show? Do the numbers spike in the areas of these stadiums? Do the numbers go up? Does the death rate, hospitalizations equal? It's very difficult to look at the spring break. You know, people say, well, didn't we have that for spring break? The answer is really no, because when you have transient people that go to Florida or Texas or wherever, and they enjoy themselves, and then they go home, those infection rate actually hit their home state and not where they were, right? And so you can still look at those towns and say, well, if you're bringing all these people together, shouldn't the numbers have popped? It's difficult to say, but if we see an isolated community that starts having large events, we can start putting some data behind this. And so I have a feeling in the next 6 weeks, the answer to that question will be a lot higher, right? The other thing is, I think you can't give a global answer for that question, because each event is very different. If you're doing weddings, right, the bride and groom may want to protect grandma and grandpa, and they want everybody masked up and tested. And you may be doing a concert where your population's just not going to buy a ticket to come in. And so it's mitigating the risk as you can do it with the expectations of your guests at or above the level of your jurisdiction. Now, if you personally feel your commitment to your guests is higher, I would encourage you to always do as much as you can to mitigate that, whether it's cleaning or distancing or thinking outside the box, where you still have your 2,000 people there, but maybe spread them out or segment them into pens or whatever. I think if there's ways to get creative that allows people to feel protected, allows your risk to go down, and works with the local jurisdiction. So it is a difficult question, just because each venue and type of event is so different, that I'd ask you just to kind of look at what you're doing and how you can apply the best practices forward.
Great. I'm going to ask one more question, and then, gosh, where did that hour plus go? Question from Stacy. Can you elaborate on the waiver for 250 plus attendees piece of the DC plan for larger events? how do we obtain a waiver? Who obtains the waiver? Is it the venue, the planner, et cetera?
I'll answer that. Typically, it's the venue. The planner could do it on behalf of the venue, and they would apply in DC directly to the special events, the HEPRA or the Department of Homeland Security special events. I would anticipate in the first wave of those waivers, which have already gone out, you're looking at stuff like soccer stadiums, baseball stadiums, large-scale national events, and over months of proof of concept with those waivers will become more available to general events, but I don't see them being applied to general events for some time.
Okay, let me see. There's one more question. Some of these we've already covered. Can we require vaccination from employees who don't have medical exceptions when they become eligible?
I'll take
Drew?
that. I was just on a university panel where universities are going to start mandating in this region and across the country, their students be mandated coming back. I think it's a difficult thing to do. We don't have long-term data that shows, at least on the new mRNA stuff, we don't have long-term data. Other types of vaccines, we do have long-term data. Initially and to date, 6 months into this, they are safe. I've taken it and I've given them to my family. It will be difficult for mandation of this, but as we get farther out with data, that may become more and more a norm.
And if I could touch on that as well, we've had that question regarding events as well. And, while we may not as an organization mandate our staff to be vaccinated, our clients may, or the universities may, or the venues may. So I think that there's a little flexibility around that, and I think that it'll all depend on where you are and who you're dealing with. And if I can go back to the hard question that you asked a few moments ago, one of the things as planners, project managers, event managers, we do have the responsibility of the health and wellness of the people that are going to come to our events. And we do have a responsibility to our clients to make sure that they are as informed and aware of all of the things that they should be when they're making their decisions. For instance, I went back to the event that we did right in the middle of the pandemic. They wanted everybody to come. Nobody wanted, they had to have everybody there. But what we did was we were able to provide them with a level of information and mitigation measures that we could put in place that would not make people feel like their civil liberties were being, infringed upon. But we were also keeping people safe. So we do have a duty of care as planners and event managers and venue managers to make sure that we are doing everything in our power that we can legally do to make sure that everyone is safe, whether it's from infection or trip hazards for that matter. Safety. There's a lot of things that we should do as planners and good stewards to our clients, our community, and our guests, and our staff, for that matter.
Right. So a last question, and this one will come from me. What is the one thing you need our audience to hear to help anchor them as it relates to COVID compliance and safety for the rest of 2021 as events begin to open up, and also for gatherings in, spring 2022? So, Drew, you want to tackle that one, start us off?
Sure. I think the thing that I would say to everybody here is education, right? The education can be free. The more you understand why you're doing something and why you're being asked to do something, the better you'll do it and the better you'll incorporate it, right? And so not all these things are costly. There's some things you can do that are inexpensive, not expensive, that are, easy to do. And I think that really comes with education. My other ask, and we're seeing this in the DC area, and it's truly amazing, is our event people have stepped up and our venues have stepped up to help with the vaccinations. And so my thought is, the more we can all be part of the solution, the faster we can get to the end. And so if you have the ability to host a vaccination clinic, or house a vaccination clinic, or volunteer at a vaccination clinic, the more that we can prove that bringing large people together is safe, that we have common sense practices, and that we are all educated and now experts in this, the more the states and our jurisdictions will have faith that we're going to do it right going back to our normal activity. So that would be my ask.
And how about you, Steve?
Well, a couple things, and I'll speak to, because I've worked with hundreds of facilities, particularly arenas and stadiums and public gathering spaces. A couple things that I think will help everyone be able to get back to work, get back to hosting events, and do it safely. A simple matter of documenting process, documenting what you're doing. So if you are challenged to say, why should I feel that you are safe to host an event? And you can say, this is why, this is why, this is why. Start with standard operating procedures, make them detailed. Okay, understand exactly what the tasks required are for infection prevention. And of course, I'm speaking from a cleaning and disinfecting standpoint. Risk assessment, just take a floor plan of your space and say, where are my highest risk areas for infection in that space? Is it the lobby where everyone is entering? And come up with a plan to help distance people and decrease those risks. And along with the documentation is hold yourself accountable. Create something that forces you to periodically look at, okay, here's the goal that we set, or the improvements that we wanted to make. I'm going to look at it next month, and we're actually going to sit down and record data, and we are going to hold ourselves accountable. And again, that will allow you to have real numbers, real facts, real data to prove to someone, this is how we're doing it, and this is why we think it's safe.
Right. And then, I like what Drew said about, together we can all get to the end. There's some light at the end of that tunnel, and it's not the train coming down the track at you. But one of the things that I think is super important is that people, while we're working remotely and we're by ourselves and things like that, really, truly, we are not by ourselves. We have each other to help, get through this. And I would say that one of my biggest advantages is that I have a number of great partners, people like Drew, people like government agencies, like the Department of Health, like the Mayor's Special Event Task Group. They are there to help us. They want to help us. So I would say to you, reach out to your local agencies early in the planning. The worst thing that we want is a surprise on the day of the event, right? Oh, you can't do that because why? Bring them into the planning early, just the same way that you bring your vendors into the planning early, including people and not just being the only brain trust in the room. Have multiple people help you with your plan, because they are the experts. The people who do the job on the street every day are those experts. Include them in your planning process. Include local agencies, hospitals. I can't even, I'm going to toot Drew's horn. Drew has been a partner with us for many, many years. And through this COVID, him and his group of folks have helped us really approach this in such a educated and knowledgeable way. So, please reach out to others. They are here to help. And the Live Events Coalition has done an amazing job, bringing this industry together as one voice and just a group of great talent. So, stay safe out there, stay safe, and take care of your industry brothers and sisters.
Well, that's great, and I want to just say thank you because we're approaching the end of this hour and 15 minutes of time. I just want to thank our panelists, Lindemud, Drew Maurano, and Steve Arehart for their time today and their contributions. Also want to thank the audience for really some very great thought-provoking questions. And also a shout out and a huge thank you to the Live Events Coalition who brought you this webinar. And really thanks to everyone for their support, because in all truth, we can't do any of this without you. I just want to leave you with a few final thoughts. We're really no longer talking about COVID compliance. It's kind of like a flip of the script, if you will. So my new public declaration is this, which I'm going to give credit to my safety colleague, Brian Honeycutt, since he shared this with me way back in September. I know that doesn't seem like long ago, but it kind of does to me. This is not only about COVID, it's really about safety. And we need to change from a COVID compliance culture to a safety culture, because our industry is people first, safety always. Linda touched on it a few minutes ago about safety, and safety is not COVID specific. COVID is what got us to think and talk about safety in a way we never have before. And we're no longer talking about safety, but risk assurance on all levels, which includes health and safety needs. So the bottom line, in my opinion, safety is paramount. It isn't expensive, it's priceless. And I believe that it's our job to make sure that every single person gets home safely from one of our events. That's my responsibility as an events professional, and that's our collective responsibility as an events industry. That crucial responsibility lies with every single person who has a career in live events. So with that, I want to thank everyone. It's been a real pleasure to be with you today. We appreciate your time in being here, and we hope you got some really great takeaways. I know we'll see you again, and we look forward to the opportunity to meet again safely and hopefully in person soon. So thank you, everyone. Have a great rest of your morning, afternoon, or evening, and safe events.
Thank you so much. Take care, everyone.
Stay safe.